As a therapist in New York City, I like to think that I'm fairly well aware of the mental health needs people face. However, I must admit that reading statistics recently was quite shocking. According to the National Alliance on Mental Illness, 1 in 5 US adults experiences mental illness each year. This is about 51.5 million people. Suicide is the second leading cause of death among people ages 10 to 34. And mental illness and substance use disorders are involved in about 1 out of every 8 emergency room visits in the United States. Additionally, as I looked at stats from the CDC related to COVID and mental health, they had recently found that in June of 2020, 40% of US adults reported struggling with mental health or substance use issues. In a survey the CDC recently conducted, 31% of respondents reported symptoms of anxiety and depression. 13% reported starting or an increased use of substances. 26% reported stress-related symptoms. And 11% reported having serious thoughts of suicide in the past 30 days. And according to the National Institute of Mental Health, these rates are nearly double what would have been expected before the pandemic. And what's even more troubling than the prevalence of mental health issues is the lack of access to care. Another survey done by NAMI found that 34% of people who had looked for a therapist had difficulty finding one. They also found that 33% of people looking for a prescriber also had difficulty finding one. And this far exceeded the difficulty people reported when trying to find a medical specialist. Only 13% of people reported having difficulty when looking for a medical specialist, and only 9% had difficulty when looking for a primary care doctor. This difficulty in finding mental health care forces people to look for out-of-network providers, which can be very costly and for some people not feasible. For many people, this actually means not getting any care at all. Another study done by the National Survey on Drug Use and Health found that more than a quarter of adults who experienced serious psychological distress reported an unmet need for mental health care. Almost half of the people with this perceived unmet need reported that they did not receive care because they could not afford it. And even more shocking is that almost 40% of those who felt they could not afford care had commercial insurance. Clearly, there's a huge need to increase access to good quality mental health care. That is why I'm so excited to be making today's video. We're going to be talking about 2 startup companies, Alma and Headway, who do just that. Now, when I first decided to go into private practice, I had heard about Alma and Headway, but I didn't know much. So, like anyone else, I decided to hop on YouTube to learn a bit more. But to my surprise, there was nothing there. That is why I'm making today's video. So from the perspective of someone, a provider, a real provider who's been using both Alma and Headway for quite some time, I want to give you a rundown of what both Alma and Headway do, how they help out, and all the things that they offer you as a provider. But before we do that, if you haven't done so already, please do go ahead and subscribe down below and go ahead and hit the thumbs up on this video. It really is helpful. But no pressure, only if you want to. So let's start with a few general comments about both Alma and Headway. Now, like I said before, they are both trying really hard to increase access to good quality mental health care. And now, one of the main ways they've done this is by making it easy for a mental health provider to be paneled with an insurance company. Now, if you know anything about being paneled with an insurance company, the process is horrible. It takes so long, it costs a ton of money, there's no guarantee you'll even be paneled, and if you are paneled, the reimbursement rates for mental health providers are so low. This is probably why most people don't take insurance. It's not that they don't want to, but it's that the process of dealing with the insurance companies and the reimbursement rates make it just a terrible and not worthwhile process. But thankfully, Alma and Headway have really made this easier. They will actually get you paneled. You don't have to do any work other than sign up for Alma or Headway. They will do all of the work for you. They'll get you onto the panels. Not only that, but they've negotiated reimbursement rates for you, which are definitely higher than traditional reimbursement rates. Now, I would say this is probably the main draw for someone going into private practice to want to sign up with either Alma or Headway. This is also awesome for clients or anyone looking for mental health services because now there's a whole bunch of therapists and mental health providers who can take insurance. And in addition to getting you paneled with the insurance companies, they actually do all the admin work for any ongoing clients that you see who are using their insurance. So they will do all the billing, all the processing, all the claims, all that stuff is done on their end. This, I can't express how huge this is. Not only are they getting you paneled, but they're also doing all the admin work after you start seeing clients who are using insurance. This is awesome. Now, I would say the other main draw that they have is that they both have provider directories. And obviously, this expands your reach to potential clients and gets your name, your practice, your business out there. This is obviously a really good thing. It is important to know that there are differences between Alma and Headway, so let's go through a few of those now. Now, for the most part, when you sign up with either Headway or Alma, you get paneled with the same exact insurance companies. I'll actually put a list of the insurance companies on the screen, a side-by-side comparison so that you can see. You will notice that when you sign up with Headway, you have the opportunity to be paneled with one additional insurance provider, and this is Cigna. Now, this is important if you're trying to grow your practice. It opens your doors to a whole different population of people who have Cigna insurance, which could potentially be a lot of people. And another difference, and this one is quite significant, is that Alma requires a membership fee. When I signed up, this was about $99 per month, and Headway is completely free. But there is another caveat, and that is the reimbursement rates with Alma are significantly higher than the reimbursement rates with Headway. And I can't go into specifics, but just to give you an idea, the same service provided through Alma and Headway could potentially be a $30 difference. This is quite significant. So in the long run, the membership fee might actually be worth it. Now, I know I mentioned before that both Alma and Headway put you on their provider directory, but there is quite a big difference between the two. Now, it seems that Alma is much more focused on the people looking for therapy. So they're actually providing a service for clients as well. That being said, their directory is really robust. It has a client matching system. It looks really nice. The layout is really good. And I think actually a lot of people go to Alma to look for a therapist. So I've actually gotten quite a number of referrals right from the Alma directory. On the other hand, I've never gotten a referral from the Headway directory. It's not nearly as robust. And I don't think that Headway's focus is on people looking for therapists. I don't think the focus is on the clients, but rather the provider. So it is important to know that the Alma directory is much more robust. You get many more referrals through there as opposed to the Headway directory. Now, just to go back for a moment, I did mention that Alma required a $99 monthly membership fee, but you do get some benefits with that. For one, you get added to their listserv, which is basically a big online community of psychiatrists and therapists and all sorts of mental health providers. This is a place where you can ask questions, look for resources. People are looking for referrals on there. It's really, really a great community and a really, really great resource. Additionally, with Alma, you get access to a whole bunch of different events. I do think that before the pandemic, these were in person, so really good networking events, some really good like continuing education type events, and they've still been doing it via Zoom. So for example, the other month I went to an event that was hosted by a CPA, which was really awesome considering I don't have any business background or any finance background. I was able to go onto a Zoom meeting with a CPA who really focused on private practitioners. This was really awesome. And this was only a benefit that was provided from Alma. These are not benefits that you get with Headway. Let me just share with you my final thoughts before we wrap up today. Keep in mind, I am currently enrolled with both Alma and Headway. Both have been really, really helpful for my practice. They've provided a great service, and I think they're doing great things. That being said, if I had to choose just one, thankfully I don't, but if I had to, I would definitely go with Alma. This is due to the higher reimbursement rates, access to the community, as well as access to all the events that they put on. The good news is, I actually don't have to make this choice, and neither do you, because Headway is free and requires no commitment. So even if you just want to check it out, you can sign up with no commitment, no contract, nothing like that. And that is it for today's video. Hopefully this was helpful for you. Hopefully you learned something about Alma and Headway, at least enough to make your own decision. Now, I will be posting consistent content to this YouTube channel, so do go ahead and subscribe down below. I look forward to seeing you soon.